This is an additional lecture to Module 1, and this is the history of public health nursing. I always think it's important for us to understand where we came from and why we have public health nursing currently in our curriculum for the BSM program. So, early public health, through the ages, all people have been concerned about birth and death and illness and these events that affect their lives. And we've seen in history the ability to preserve health and to treat illnesses. We know that the Native Americans of the United States had methods, had herbs that they used, that they shared with the English people that came over. We know that a lot of cultures use herbs and use methods to make their people healthy. Some examples are the Egyptians that mummified their dead and put in items into their where they buried their people. We know that the Romans had ways of cauterizing wounds after war. We know that the Elizabethan Poor Law gave charity to people to help those who were poor and dying from malnutrition, from tuberculosis. And then we know that the Industrial Revolution brought on a lot of urban public health issues. So these are some pictures of Pittsburgh on the right, the steel mills blasting out toxic smoke, making the steel beams, making the steel for progress in the Industrial Revolution in the United States. But these were problems that were also in England and in other countries that were developing. The picture of the young boys, they were school age, but they were not in school. They were helping the Industrial Revolution in the sense of going to work. They were taken out of school and put to work. These were the breaker boys. They were in the coal mines, sifting through, finding the last bits of coal for the owners in order to make the most of the coal that was mined. And then we see the urban conditions of crowding, poor conditions with trash around at the bottom of the picture. We know that crowded conditions spread diseases, spread tuberculosis. These are fire hazards, and so we know that the Industrial Revolution, while it was building countries, was also creating a lot of problems, bringing people out of the farms and into crowded, dirty cities. So Florence Nightingale started training nurses. She went to the Scutari and helped the military, helped the wounded come back healthy, and then she started a nursing school and started to give advice to schools around the world. And the first U.S. nursing school opened in 1870, and then we see those were hospital nurses, but then we see the visiting nurse associations opening in 1885. And I want to mention Lillian Wald and Mary Brewster, who went into New York City, into the Henry Street settlement in 1893, and Lillian Wald had a benefactor who helped give her money, and she started a program for the Lower East Side immigrants who were coming in from Europe and coming into these crowded, dirty New York City. And her and Mary Brewster lived there in the community, and more nurses came, more nurses trained and went out to form public health nursing and visiting nursing associations across the United States. Here's a picture of the Philadelphia Visiting Nurse Society, which is still active in Philadelphia. They have an inpatient hospice, but they also have a large home care organization doing home visits, maternal child visits, hospice, and adult home care visits. The nurse is in the hat, and you can see some of the conditions. The one child standing on the mother's lap looks cachectic. I don't know if that's the grandmother holding the baby or if she's a friend, a sister-in-law who's pregnant also, and then there's a baby, and then there's the little baby in the carriage with the dirty dress. And we know that these row houses and these tenements were very crowded and spread diseases easily. So here we have a picture of Lillian Wald. And again, she lived in that community. This is the Henry Street Settlement. You can still see it. It is now a social service organization. It is no longer a visiting nurse service. But Lillian Wald really spurred people into action. And the settlement movement was happening in the late 1800s, early 1900s, helping these immigrants who were coming to the United States. U.S. nurses took public health global. They went to Japan, to other countries, to South America, to help start public health nursing. Some of it was mission work, but some of it was with philanthropic organizations such as the Rockefeller Foundation. And they went in to help women. They were always promoting it for women. And they often found that the nursing schools needed to be boosted in their nursing care, and then could go into the public health. But they really did help to bring a type of independent practice, because nurses who were in the community really were working independently. They were going door to door, they were going into the homes when someone needed help, and they were determining what was needed. When we look at home care today, those nurses are being caring for a patient under physician's orders, but in the past, nurses were very independent. So we know that war adds skills to physicians and to nurses, and in the early 20th century, public health nursing really was a specialty. Nurses went into their 2 or 3 year training programs in hospitals, and in order to become a visiting nurse, oftentimes they took a course or several courses. Nursing wasn't as organized in the beginning, and so sometimes public health nursing was in the School of Education. Bachelor's degrees were not being given at that time, although nurse leaders were working towards it. But when you think of what public health nurses had to deal with, they were dealing with World War I and the tremendous injuries that veterans came back with. The 1918 flu pandemic, which means that this terrible flu that killed healthy people who were out in the working world was killing them across the world, and millions died during this pandemic. And this is what public health nurses are fighting for now, that type of flu does not come back. School nurses were started with Lillian Wald. Occupational health nursing was beginning in factories in crowded cities where women were sitting all day, where men were sitting, where there were hazards with the machines that they were working with. Nurses were in helping to care for wounds, helping to promote health. And then I want to mention also the Frontier Nursing Service, which is still active, which was maternity services in the Appalachian Mountains. And Mary Breckenridge started that, and if you're interested in becoming a midwife, you can still go to the Frontier Nursing Service to become a midwife. After World War II, public health nursing focus changed because we weren't having as many communicable diseases. We had vaccines that we were giving out, and so communicable diseases were more under control. Whooping cough, diphtheria, tetanus, those were being controlled. And now we saw the rise in chronic illness after the 50s. And by chronic illness, I mean we saw cardiac disease, people who were smoking, lung disease, diabetes. We had insulin development in the 1930s, which meant that people could live now with diabetes instead of just wasting away from the sugar not being utilized by the body. And so we also saw that the baccalaureate degree was rising in number, but also at the same time the associate degree, which did not qualify for public health nursing, which is why you are currently taking public health nursing in a bachelor's degree program. Home care began in 1965 when Medicare started, and that's when nurses went under the orders of physicians. Hospice movement began in the 1970s so that people could die at home instead of in institutions. We saw Alma Ata in 1978, and Healthy People, we talk about Healthy People 2020 now, but it really began as Healthy People 2000 in 1979 with President Carter and C. Everett Koop, who was the Surgeon General. And we see that we haven't met our goals yet, but we are working towards them. Healthy People 2020 being the federal goals for public health. And then we have HIV that started in the early 1980s, and we see how far we have come with that, which is another reason to mention why public health nurses, all nurses, need to always be active learners, always learning about new diseases that are coming out, new responses, and then new medications. So globally today we have rising tuberculosis rates, we have rising drug use, rising suicide, we have regions without water, we have disaster areas. We see disaster areas in the United States with fires, with tornadoes, with flooding. We have continuing death due to new communicable diseases such as Ebola, such as Zika. We see what Zika has done to newborns, and then continuing war and violence. And so our work is not done, but I thank you for listening.